Hi everyone, my name is Natasha. In this video, I'll be talking about Midge, a 72-year-old woman from a rural community. I'll be focusing on two main areas. First, how social determinants of healthcare affecting her care. And second, some possible differential diagnoses that can help explain what she's experiencing. So social determinants of health are basically conditions in someone's life that influence their overall well-being, such as income, education, access to care, and social support. For Midge, a few key factors are playing a big role in her situation. For instance, money and living situation. Her family struggles financially. Her daughter works 2 jobs just to keep things going, which means there's probably not much left for medications, food, or reliable transportation to appointments. Another point is caregiver stress. Midge is caring for 3 young great-grandchildren by herself most of the time. That's a huge responsibility for anyone, but especially for someone her age. And it can cause being tired, having anxiety, or having a cognitive decline. Another point is limited healthcare access. Since they live in a rural area, they may not be near clinics or specialists. Missing her blood pressure pills might not be the only forgetfulness that she has. It could also be because she doesn't have consistent access to refills. Another point is education and understanding of health. Midge left school when she was 15 years old, which can make it harder for her to manage complex medical directions or recognize signs that something is wrong. A last point is social isolation. She doesn't seem to have much help or interaction outside her family. That isolation can worsen confusion, depression. It may even make her have hallucinations or feel more real, or feel frightened. Altogether, these issues make it harder for Midge to manage both her health and her responsibilities. Her environment, financial stress, lack of support, all affecting her mental and physical well-being. Next, let's look at some possible explanation for Midge's symptoms, like seeing someone on the woodpile, confusion, change in her behavior. Dementia with psychotic features. There's a strong possibility because her memory issues, confusion, and visual hallucinations all point toward a neurocognitive disorder such as Alzheimer's or Lewy body dementia. Second point, delirium and medical causes or mismedication. If she's skipping her blood pressure pills or dealing with an infection that could cause temporary confusion or hallucinations. That is something we need to rule out with labs or medical evaluation. Another point is late onset psychosis or mood disorder. Even though she doesn't have a psychiatric history, sometimes psychosis can develop later in life, especially when combined with stress, grief, or chronic illness. Last point is major depressive disorder with psychotic features. Losing her husband, being isolated, or feeling overwhelmed could have led to severe depression that includes psychotic symptoms. To figure this out, I would want to do a cognitive screening, like a mini mental state exam, or the MOCA, or check in her vitals, or order labs to confirm she's taking her medications correctly. In summary, Midge's situation shows how social factors like money, access to care, and family stress can directly impact mental health in older adults. Her hallucinations and confusion could come from medical, cognitive, or psychiatric causes. So a full evaluation is needed, and the support plan are needed to really help Midge. A team approach, including her primary care provider, a mental health specialist, and community support, would also help improve her safety and quality of life. Thank you, everyone, for listening. I appreciate it. I'm looking forward to looking at your videos on this geriatric case study of Midge. Thank you.